We're going to show you the most complete understanding of acne and what the natural solutions are to really help this challenge. And we're going to take you back into, back in the 50s, the Pasteur Institute, they looked at this and they decided it was a problem with gut ecology. It's an imbalance of gut ecology. So they thought it was going to be simple. We're going to use probiotics. They did that, and that really didn't help. So the Americans took a different approach, and that's when they started tetracycline. And tetracycline didn't help either. And so then we started to see these over-the-counter products, which really were some challenges as well. And that is when they started to try to eliminate the P. acnes bacteria. That's the Propionibacterium acnes. And these don't get to the cause of the problem. So we're going to take a look at this and show you what you can do and what you need, the way to look at acne, which is a little bit different, and things that you can do to help overcome that. So the thing about this is that first, it tends to become worse during any hormonal changes, any imbalances within the hormones. So one of the easiest things to do is to do grounding. And Dr. Sokol and Sokol, they've discovered that by touching the earth with your bare feet for about 15 minutes per day, that is the primary regulator of the endocrine system. And in fact, they measured the adrenals and found almost instantly when you ground, that immediately changes. And so it's all about plugging your bare feet into the ground, because the ground, if you haven't seen our video on grounding in sunshine, it's really critical to have a great understanding of this, because it'll change your perspective really forever. Now, there's a couple other things. Don't wash affected areas of the skin more than twice a day. Frequent washing may irritate the skin, actually make the symptoms worse, but you don't want to have this congested, particularly if you're participating in sports and things like that. You're going to have to make sure that you clean that out. Now, to wash that, you're going to use a very mild soap or cleanser. We have our body wash. There's also some recommended really alternative or substitute facial cleansers, which we'll get to in a little bit. And you want to use cold or at the most lukewarm water. Really hot water is going to make this worse. So you want to use the cold or temperate water. Now, I talked about that there are some substitutions that you can use for like facial cleanser, toner, moisturizer. Coconut oil as a facial cleanser with cold water. You know, like I said, our fragrance-free body wash is very mild and is all natural products. It's really incredible, and that's why I recommend. You can use raw milk, and very, seldomly you can use a milk soap or a sulfur soap and iodine. As a toner, you can use coconut water, which is excellent. And as a moisturizer, aloe vera. We do have an aloe vera lotion. It works fantastic. Now, some of the things that you don't want to do, you don't want to try to clean out the blackheads or squeeze these pimples. This makes it worse. It can cause some permanent scarring, and you don't want to do that. Curcumin may be a really low-cost, well-tolerated, effective agent in the treatment of these issues. We have our curcuma most, which is a liquid that's designed to be absorbed rapidly. There are associated biofilms, and that's one of the biggest issues. Why the probiotics didn't work, why treating the P. acnes doesn't work, why the tetracycline doesn't work, and that is because bacteria and viruses, these microbes, produce a thick polysaccharide shield. It's called a biofilm. So you need to break those biofilms down. One of the best ways to break it down is allicin from the fractionated portion of garlic, We use Alimost, which has allicin in a very powerful formulation, and that works fantastic. So that's our Alimost. If you're younger, if you're a teenager, you can place a teaspoon of pink salt. We use the Nutrimost pink salt in 16 ounces of warm water and drink that. And that's going to increase the hydrochloric acid in the digestive system. And that works as a cleanser in the body as well. Now, you want to avoid too much makeup and cosmetics. Always use water-based products that are described as non-comedogenic. That means the product is less likely to block the pores of your skin. So it's all about trying to keep this all clear. Now, you want to always completely remove any makeup before going to bed. Get 8 hours of sleep. Minimize blue light at night. And if you have dry skin, if that's a problem, use a fragrance-free, water-based emollient. Shower as soon as possible once you finish any exercise or sports, because sweat can definitely irritate acne. And your daily soft drink consumption significantly increases the risk of moderate to severe acne. So particularly if you're an adolescent, want to keep that sugar content really low. Soft drinks should not exceed 100 grams per day. Here's the thing. Food can greatly, and I mean greatly, affect acne. That's one of the reasons we use food pharmacy. And we go on the food pharmacy and use the food pharmacy recommendations. We use the recommended food pharmacy settings first, which takes out a lot of different toxins. We'll select acne. We'll restrict high histamine foods. We'll restrict the release of histamine foods, and we'll restrict phytoestrogens. And that does an amazing, amazing job. Now, on food pharmacy, you have to understand these selections are going to incorporate a number of different things. Number one, you have to understand what are the possible predisposing factors. It's a diet high in refined carbohydrates. It's hormonal insufficiency or imbalance. If you have excess iron in the diet, insufficient vitamin A and vitamin E in the diet, if you have insufficient zinc or magnesium in the diet. But selecting this option will increase vitamin A. It's going to increase your omega-3 fatty acids. It's going to increase zinc. It's also going to decrease high glycemic foods. It's going to decrease dairy foods. It's going to decrease alcohol. All of that is going to help the system. And all of that is going to help your acne. So let's take a look what this looks like as we select those on food pharmacy, because food is the most powerful thing that you can do to help guide your body. So if you follow these recommendations, and by the way, when you first start following them, initially, you may have a little bit of a flare-up. However, if you follow the food that we recommend using the food pharmacy, that's going to restrict the high histamine foods, restrict the histamine releasing foods. That's going to settle that flare-up down. What you're going to find is this is going to just gradually improve and improve in a relatively short period of time. I mean, it's going to take weeks, but you're going to notice a profound difference in just amazing skin. So let's look at what we would do with food pharmacy. Okay, once we log into food pharmacy, we're going to select the use food pharmacy suggestions. You're going to see it's going to take out the carcinogens, toxins, and GMOs, fluoride and chlorine, harmful fats, mercury contaminated foods, and non-food items, as well as refined sugars. Next, we're going to jump to the conditions and challenges. We're going to select acne, and we're also going to jump to the custom conditions. We're going to restrict high histamine foods. We're going to restrict release of histamine foods. And we are going to go to the macronutrients, and we're going to go to phytoestrogens, and we're going to restrict phytoestrogens. We can finish that. We're going to go to our patient food list, and you see what's generated. And this is going to be the foods that are going to be eliminated in red. The foods in green, eat more of. And most of the foods are just going to be in the neutral range. And we would combine this with the other items to create that. Now, we can also see, let's close this, our detailed food report. And you're going to see that as we come down here to acne, it's going to give us some self-help tips and what this is going to also, how it's going to work in the body. In our standard disclaimer, the information provided is for educational purposes only and is not medical advice. The statements made are the opinions of the participants and have not been evaluated by the Food and Drug Administration. By providing this information, we are not diagnosing, treating, curing, mitigating, or preventing any type of disease or medical condition. This is not intended as a substitute for professional advice of any kind before beginning any type of natural, integrative, or conventional treatment regimen. It is advisable to seek the advice of a licensed healthcare professional.